Hi again, it's Jennifer Schmitz from the Schriever Guardian Resilience team. This is a short video to discuss depression and anxiety symptoms as they are the most common. Anxiety and depression play an important role in our lives and can even be very functional and helpful. Humans are not meant to be happy or in Zen peace all the time. That would be dangerous. Sometimes we really need our spidey senses to keep us safe. So I don't want to pathologize these symptoms to the point that you are feeling anxious about being anxious or depressed because you are sad. In this video, I really want to point out when it may be time to get medical or mental health assistance. We are going to look at when the symptoms are causing more harm than good. Often people will act or look a certain kind of way. Maybe they're super negative or worried, they have trouble with sleep, they're irritable, or maybe they don't even want to be around anyone. Again, these are very common behaviors when we're having a hard time. Hopefully they only last for a short period and resolve on their own. But if they don't, then it might be time to seek assistance. So let's go over both depression and anxiety to review if it is more than just feeling frustrated or blah. As mental health professionals, we look at constellations of symptoms, not just one or two. Similar to how your PCM will not diagnose someone with pneumonia when you just have a cough, we won't diagnose a mental health disorder if you are only feeling irritable or sad. We will do an assessment to figure out how your symptoms are impacting your life and make treatment recommendations based on that. We want to get the bigger picture of you and your situation first. It is possible to have both symptoms of anxiety and depression, and you may see some similarities in these lists. However, as I mentioned in the first video, they are all symptoms similar to a check engine light, indicating something is out of balance and needs attention sooner rather than later. Over time, you may begin to recognize and change what you think and what you do in order to reset your balance all on your own. When is it time to seek help? Well, you may notice you are having trouble getting work done at home or on the job. This is usually happening over weeks or months and not improving. It is impacting your ability to function in your life. You may notice the relationships you have with your spouse or your kids worsen, or with friends or people at work. Additionally, you may not be very interested in things you used to do. More and more irritability and isolation is having a pretty significant impact on your life. You may notice you don't care about your hygiene or how you look. You may have tried many things on your own, but nothing seems to help. You are stuck. Ultimately, you may begin to think you would be better off dead. At its worst, this could be thoughts you could kill yourself. If that is the case, I would say doing a walk-in appointment at the mental health clinic or the emergency room would be your best bet to ensure you are receiving timely and optimal treatment and you are safe. However, even if you do not have suicidal thoughts, but you are feeling like it would be okay if you stopped living tomorrow, well, that in and of itself is still a pretty significant check engine light. I would recommend if you feel this way or have any of the indicators listed, you enlist either chaplains, primary care providers, grit teams, MFLAC counselors, or mental health clinics to be assessed and referred to the best spot for treatment. It is better to treat these symptoms before they grow. Again, if you have any thoughts, comments, or questions, please feel free to reach out to me or your mental health provider. Have a good day, and I'll see you in the next video.